A lot of people worry about the side effects, especially putting on weight. Yes. A lot of women go, well, this Jodie says I went from a size 10 to 12 to a size 20 and weighing 15.5 stone. Haven't been able to shift the weight since. I'll never go back on the pill again.
So in the combined pill you have oestrogen, and oestrogen has been linked loosely to weight gain. Now, to be clear on it, it doesn't directly cause weight gain, but oestrogen can increase your appetite and it can also cause some water retention. Now, with modern day pills, the oestrogen dose is actually so low that does it cause weight gain or not? But it's certainly any weight gain above 2 kilograms can't be attributed to the pill alone. So if you're gaining more weight than that, think of other causes.
Dr. Carroll, you say the makeup of the pill is still a work in progress. How different is it to that pill from 1961?
Oh, it's very, very different, because the pills in 1961 had really high doses of oestrogen, and of course it's a dose of oestrogen that's the most strongly linked with serious complications like clots in your veins, DVT. So those doses of oestrogen have come right down. But at the same time, manufacturers have been developing different kinds of progestogen, because that's the other hormone in the pill. So it's been a juggling act, bring the oestrogen right down, refine the progestogen so it has a minimum metabolic effects. Because, as we know at the moment, the pill isn't always suitable for women with diabetic complications, for instance.
Well, there are 4 generations. Within those generations of pills, there are different names.
Yeah.
So would you have to try different ones until you found one that suited you? Yeah,
I mean, there are so many different indications for the pill. Obviously, preventing pregnancy is the #1, but sometimes people may take the pill for acne, for irregular periods, for painful, heavy periods, or even to treat the symptoms of endometriosis. So, depending on what the cause, the reason why you're taking the pill will affect that decision. And also just depending on you as the individual. You know, sometimes people may come and say, my cousin's friend gained 2 stone when she went on the pill. That doesn't mean you will. So finding the right balance of hormones for you is the most important thing.
And if you're on one that you don't feel quite right with, just go back to your GP and discuss. And
well, absolutely. I mean, it's a very individual. It's a very individual thing. It needs to be tailored to that woman. I mean, in general terms, they can tell you that if you're overweight, if you're a heavy smoker, if you have diabetic complications, if you have a family history of heart attack or of stroke or of blood clots, or if you have certain types of migraine, then the pill is not the most suitable thing for you.